So my question about closure was, I will see, a random sample of 10 patients who had a total knee replacement, who are basically the same age group, same fitness level, same function level from the same surgeon. And I will just see vastly different outcomes in terms of range of motion, how quickly it comes for some, how challenging it is for others. And my question is, being fortunate in that I get to spend so much time with these individual patients, I really genuinely know they are doing everything in their power, doing everything right, probably overachieving in terms of what they're supposed to do. And yet for some, they walk in one day post-op holding a cup of coffee. You would never know they had a knee replacement. And I've got other 12 weeks out that they're struggling to get to 90 degrees,
Right.
end up having a manipulation. And my question to you is there any research? Is there any indication, anything out there that would suggest why one person could have such a struggle while the other person just kind of breezes through the recovery?
Yeah, it's not just your surgeon. It's my own experience. It's every surgeon's experience. Whoever tells you otherwise, they either haven't operated on enough patients or they're just sort of kind of fudging the data. So, and that's the frustrating thing, right? Because we as surgeon do hopefully the same operation on everybody the same way, and that's sort of what's nice about my field. And some people consider that boring because you're doing the same thing over and over again. I think that's the challenging part, to do something over and over again and do it well. I think that's a challenge. That's such a challenge because you're being asked to do sort of perfection over and over again. And so, but yes, why is some patient walking in and crushing it? And I have some patients, like I said, I literally have 4 or 5 hours after surgery just holding their walker and walking out of the hospital because I do same day surgery. Versus some are just to this day, 6 weeks later, still using a walker. And people scar different ways, and people scar differently. So there's certainly for the ethnic groups are more prone to that, and especially in the African American population, you can see those sometimes with their scars alone too. We can see that little not keloid, but sort of keloid, like it's called a hypertrophic scar. And so you can see those raised bumps versus someone has that little pencil thin skin, incision, and it's healed very nicely. Sometimes you can't even see it. And so you can imagine that same thing is happening underneath. I believe my patients too, Tony, when they tell me, Doc, I did everything I could, but they didn't do as much as everybody else, and it's just what it is, and that's okay. And I tell them that's okay, right? And so what studies have shown is one of the biggest reason why people have worse outcomes or worse range of motion is pain control. So
Yeah.
depending how well their pain was controlled, and you can tell them, oh, I did my exercises at home. Well, I actually know who my patient were that had great pain control, and I know which one of my patients did not have pain control. Because guess what? I'm being called for those phone call for those refills, right? So I know exactly how many times
Right.
you were refilled for the pain medications versus somebody who told me, I never used the narcotics, doc, I took Tylenol. So I can tell who had great pain control and who didn't. And that is the number one cause of us not being able to get to. I take a picture of all my patients with a knee straight and a knee bent after my surgery. And I document this so I can show them, and hopefully this be a source of motivation for them. And I say, look, you can go to 145 degrees and you're going straight. This is you right here. And of course, you're now at 5 and 90, and it's okay. We're not here to judge or anything. We'll try to help as much as I can, but just know your knee was able to do that, and it just was not. The pain was just not well controlled. And then, of course, some of that could just be you. That's how you scar. You scar more than most folks, and you tend to lay more scar down. So those are the two biggest things for me: is not having a very well controlled pain, and just some people are genetically predisposed to having more scar laid down.